KT's response to COVID-19. The overarching theme of this presentation is how ICT can be leveraged in a national health crisis, COVID-19. KT is a global integrated ICT company and network provider in Korea. We, KT, as a private sector, have been working with KCDC over the past 5 years to strengthen the national health security using ICT. We will explain how the infectious disease can be handled with big data and AI-based approach, especially with KT's disease surveillance platform, GEPP. This training will focus on understanding how Korea is responding to COVID-19 using ICT. KT's GEPP, Global Epidemic Prevention Platform, has contributed to Korea's successful response to COVID-19 by providing digital tracing and prediction on the inflow and spread of the virus. In this course, it will provide an understanding of KT's innovative epidemic prevention platform, GEPP, and its outcome and performance. This course consists of background of GEPP, digital tracing, monitoring and prediction, and global reference and wrap-up. This course aims to build an understanding of how ICT can be leveraged to respond pandemics and share knowledge on how private sector's data and technologies can be applied to the government system as a private-public partnership. Also, it purposes to build knowledge on the types of digital tracing and monitoring and prediction in epidemic preparedness, and to show an example how these features can be operated in reality. Lastly, it is to suggest global operability of the system and give guidelines for the countries who are in need of implementing the system. Since 2016, KT has been involved in epidemic preparedness, leveraging telecommunications data for national health security. During COVID-19, because Korean government has taken the lead so well to flatten the curve, KT could successfully play a role in government's epidemiological investigation using telecommunications data. KT's cases for leveraging data for COVID-19 are more described on the government policy paper, and today I would like to introduce some of the key components among them. KT is running the GEPP, Global Epidemic Prevention Platform, which is a mobile epidemic prevention solution since 2016. GEPP is a comprehensive response system assisting national response from prevention, response, and up to prediction. In order to respond infectious disease, tracing is important because it helps to monitor the entry and spread. Digital tracing consists of international tracing, which helps monitor entry risk before outbreak, and domestic tracing, which helps to monitor spread risk after outbreak. First is international mobility tracing. International tracing helps the national risk surveillance on a regular basis. This solution uses mobile roaming technology, which enables to identify locations of customers. Therefore, government can real-time identify the status of travelers who are visiting epidemic-prone countries. The data is fed to the dashboard real-time. In addition, the solution sends SMS alerts to customers on disease info and prevention measures. Therefore, the customers can prevent infection at an individual level. Second is domestic mobility tracing. When an outbreak occurs inside of the country, domestic mobility tracing helps the government quarantine timely by identifying a travel history of the confirmed cases. There are two features: confirmed case tracing and contact tracing. Tracing of confirmed cases can identify a pathway of confirmed cases by checking out the history of their mobile locations, having recorded an aligned mobile base station. Contact tracing can identify suspects who presented on the same pathway and stayed near the infected. This function gives the number of mobile users in proximity and contact duration. This method is highly effective when there is an epidemic hotspot that government needs to rapidly investigate. The outbreak of MERS in 2015, when digital tracing was absent, resulted in 186 cases and 38 fatalities in Korea. It became a momentum for KT to pay attention to the point that identifying the pathway of infectious diseases is the most effective way to respond using ICT. Thereafter, KT, in collaboration with KCDC, developed international and domestic tracing over 2 years and applied them to the national quarantine system. This is the GEPP. The GEPP application resulted in only 1 case and 0 fatality when the re-outbreak occurred in 2018. This was possible because international tracing with roaming data enabled early detection of the first confirmed patient who visited the disease-affected country. Most recently, the Korean government, under its Strategic Test Trace Treat system, has successfully responded to this global pandemic. The digital tracing of GEPP has played a pivotal role in the trace pillar by tracking movement and contact of confirmed patients so as to prevent the further spread of virus. Also, sharing the trace information with mobile users through SMS in real time contributed to enhancing their risk awareness. In addition to the existing digital tracing solution, the GEPP is being augmented and advanced to a full-fledged platform by developing AI-based monitoring and prediction solutions. KT anticipates the GEPP will encompass and contribute to all area of the national quarantine system, and the monitoring and prediction are services to enable the government to conduct early detection and timely responses through AI and big data analysis. First, I would like to start by Outbreak Monitoring and Assessment Platform. With this data crawling system, the government can measure the possibility of the inflow of infectious disease from abroad by analyzing big data generated from various online materials such as media and SNS over the world. This data analysis, along with the entry information obtained through roaming data, can yield more accurate prediction. Next is self-check and prediction. KT is collaborating with Bill and Melinda Gates Foundation to conduct a research study on ICT-based epidemic preparedness and the studies including development of AI-based early diagnosis algorithms and analysis of infection spread using mobile data. The risk of infection can be predicted by analyzing the symptom data, such as temperature, which is measured by using IoT thermometer sensor through AI-based modeling. Moreover, by analyzing the population mobility patterns based on mobile data, the regions and infection spread can be predicted. Based on Korea's experience, KT has been leading the GEPP initiative globally. Specifically, GEPP was introduced in UNGC Leaders Summit as a due reference for private-public partnership. After that, it was introduced at renowned global platforms in B20 and WEF. Now, to promote this initiative in large scale, KT has been collaborating major projects with World Bank and BMGF. Not just a project, GEPP is in operation in some of the global countries such as Kenya, Ghana, and Laos. Many thinks that digital tracing can be executed in a country where ICT setting is favorable like Korea. However, KT could successfully launch the system in Kenya, Ghana, and Laos by customizing platforms with appropriate technology. Through these experiences, we've learned that ICT can play a significant role in bridging the gap for the countries where health infra and capacity are less developed. Particularly in Kenya, with local telecommunications company Safaricom, the system has been successfully implemented with the Ministry of Health of Kenya, and now the subscribers are about 0.3 million. Press play button to watch the video clip of GEPP launch in Kenya.
Disease knows no borders. Our world today is tightly woven together. A disease can easily be carried from an isolated village in a country 1,000 kilometers away and spread to the city of Nairobi in hours. We've witnessed the devastation: SARS in 2003, Ebola in West Africa in 2014 to 2016, the Madagascar plague in 2017. All of these outbreaks had casualties in the thousands, and there are bound to be more in the future. For this reason, we need to take a whole-of-society approach in order to tackle epidemics in the 21st century. That's why Safiri Smart is here, a global epidemic prevention tool. This tool allows the public health sector to create a first line of defense in order to reduce dependence on rumors and unreliable sources. Through a partnership with the Ministry of Health, Safaricom and Korea Telecom, we will ensure every Kenyan has the choice to receive disaster and epidemic updates to help them stay safe. And it's simple. All you need to do is opt in using this short code *265#, and you will receive updates free of charge when you cross any border, locally or internationally. That means wherever you go, you will be fully aware of any existing outbreaks in the area and also have information that will help you navigate and protect yourself throughout your stay. With Safiri Smart, you are assured of accurate, up-to-date information when you need it.
To implement GEPP properly, there are several requirements to be ready for its deployment. These requirements are governance, ICT settings, rules, regulations. Because GEPP is a platform that private sector and public sector are engaged, effective governance to lead this initiative is crucial. In light of Korea case, Ministry of Science and IT, KCDC and KT have been collaborating under the effective control by Korean government. In terms of network standard, tracing can be done in 3G and LTE condition. Using cell data in 3G and LTE network to create the pathway of confirmed patients, big data and analytics capability are also required. Finally, in terms of rules and regulations, Korea has changed the law to enable public usage of private data to respond to national health crisis. Privacy information is carefully being handled within the law frame, and after contract tracing, the information is deleted, which means government will not have the information after its usage. We believe ICT can play a vital role in emergency situations such as COVID-19 because medical resources such as test kits are not always available and developing vaccines takes long time. Therefore, prevention through non-pharmaceutical interventions, NPIs, including washing hands, wearing masks, and social distancing is crucial. Also, mobile ICT solutions can assist the NPIs and help the stages of National Response Framework from surveillance, detection, tracing, and up to prediction. Knowing the importance of ICT's role in response to epidemics, KT will continue to endeavor to strengthen the national capacity to tackle epidemics with GEPP. Finally, let me wrap up the course now. Contact tracing makes it possible to maintain economic activities without lockdown while the government effectively controls and cares confirmed cases. In terms of contact tracing perspective, ICT plays a pivotal role due to the limitation in epidemiological investigation by manual, and the investigation leveraging ICT can bridge the gap in such cases as an example, short-term memory, false statement, death. In the future, technology's role in response to pandemics will become more important. And through AI big data analysis, the related technologies will be more applied to various fields such as policy and decision-making, as well as in prevent, detect, and respond phases of infectious diseases. Thank you.